Good evening. I'm Dr. Wafaa Rashed, founder and chair of PAPERI. As PAPERI marks its second anniversary, we are proud to celebrate the partnerships and people who are shaping genomics capacity and collaboration across Africa. Today, it's my great pleasure to welcome Dr. Marina DiStefano from Clinical Genome Resource. Abigarl, over to you.
Thank you, Dr. Wafaa. Hello, everyone. I'm Abigarl Ndudzo from Zimbabwe, and I'll be moderating today's session. Dr. Marina, it's a pleasure to have you with us.
Thank you for inviting me. I'm very excited to be a part of this session.
Thank you. Let me start with our first question. Could you briefly introduce the mission of the Clinical Genome Resource and its role in advancing clinical genomics?
Yes. So the Clinical Genome Resource, the purpose of it is to perform expert curation to improve precision medicine and patient care. And so we create international groups of expert panels to perform this curation and help to improve patient care. And it's funded by the National Human Genome Research Institute. And it was funded starting in 2013.
Okay. Thank you for that overview, Doc. Building on that, I would like to ask, what motivated ClinGen to engage in training collaborations such as the workshop with PAPERI?
It's a great question. So in ClinGen, we've realized that the way to perform this curation is truly to mobilize the genetics community. We are a small but mighty team that's funded. And so we realized quite quickly that we need to train and teach the entire genetics community so that we can all share in this work and share data. And so that's why pretty soon after we were founded in ClinGen, we started to develop teaching and training materials and started a volunteer process so that interested individuals could join our expert panels, and we would do a standard training process for all of them to teach them how to do our curation. And as of today, I think we have over 3,000 volunteers. Maybe we have like 50 or so staff. And so we really prioritize education, particularly internationally. And so I would say I've been with ClinGen now 10 years. And I would say maybe in the last 5 to 7 years, we've really tried to emphasize training and workshops too, because we recognize sometimes people would like to have very specific additional training on top of our ClinGen volunteer training. And so we have been doing both in-person and virtual workshops, I would say, for the last 5 to 7 years in different curation training topics. And we found that this really gets people excited about genetics. I feel like this workshop really did get people excited about genetics, and also further increases our volunteer workforce, and particularly a train the trainer type style where you train a bunch of individuals deeply so that they can then go and train others so that we can all be educated about genetics. So we're just very passionate about learning and training across ClinGen. And I think this aligns very well with the workshop we did with your group.
Wow, that's great. And that's very insightful. Thank you, Doc. Turning now to the PAPERI ClinGen collaboration. Let me show you a glimpse from the participants of the PAPERI ClinGen workshop.
Hello everyone, my name is Adabe Joseph Nzenga. I'm a proud and an active member of PAPERI. I can define PAPERI as the platform which empowers us, young researchers and scientists, on how we can solve real-world challenges and health-related challenges in our society through implication of genomics policies. Coming to ClinGen, this platform was organized by PAPERI under Dr. Marina. It has influenced my career on how I can interpret different genomics variants. It has increased my bioinformatics skills on how I can solve health-related challenges in my society. Thank you.
I am Riyad Barfa from Algeria. The PAPERI training highlighted something essential. The future of medicine is not only about sequencing, but about clinical interpretation of genomic data. This capability is critical for building more precise and sustainable healthcare systems, especially in emerging countries. For me, PAPERI represents a key step toward that transformation.
Right, those are inspiring reflections indeed. It is clear that the workshop created a meaningful learning experience and fostered valuable engagement. Right. So building on those experiences, I would like now to ask, looking back at the ClinGen PAPERI workshop, what aspects were most impactful for the participants?
It's a great question, and thank you for showing those inspiring videos. It's always wonderful to hear about the impacts of workshops on the participants. I think that the ability to talk with me live and ask questions ahead of time, because there were such thoughtful and insightful questions, were probably the biggest strengths. I really enjoyed being able to see everyone face to face and on video and get to talk to all of them one time a week. I think that was very meaningful and very strong, and it kind of put faces to the names of people emailing me and asking questions. So I think that was the most impactful for me.
Wow, great. Thank you very much for that, Doc. Right, variant interpretation can be complex. What challenges do trainees most commonly face when learning this process?
A great question. I think that there are so many resources that you need to use because all of the resources have been developed independently, that the understanding of all of the resources and becoming proficient in using all of the resources that are required to curate variants. For example, there's not even one place that all the publications can be found for all of the variants that you curate. I think that can be the most difficult, is really knowing where to look and where to start with all of those different resources. And I think that's what makes training really critical, especially like hands-on training like this.
Yes. Yeah, that's a very important point. So looking more broadly at clinical practice, why is standardized variant interpretation essential for clinical decision making?
Yes, it's a great question. I think we all need to be on the same page to be able to give everyone equal care, or the same standard of care. At least if we're all starting with the same rules and the same training, we can all share data and then hopefully have the same data. Because I think in the past, when people were using all different frameworks, different guidelines, if you went to one lab, you might get one answer or one report. And if you went to another lab, you would get another answer or another report. Same thing goes with data sharing. If you maybe went to a big lab that had many, many cases, you might get almost a better report than if you went to a small lab that didn't have nearly as much information. And so that's why data sharing and knowledge sharing and standard sharing is so important, so that everyone can really have the same information and try to provide the same level of care for people all throughout the world.
Great. No, that's a very important point, and thank you for highlighting that. In terms of implementation, how do ClinGen frameworks help ensure consistency and reliability across different settings?
I would say we are still in the process of evaluating our impact on the field. It can be a little difficult, right, to really understand like how much people use your frameworks, but at least when we have curated using the frameworks and evaluated, different curators curating at the same time in parallel using the frameworks, it really does add a level of standardization. For example, when we created the gene curation framework, we had curators curate the same genes together at one time, and we really observed consistency in that. And they've done some of the same work for variant curation frameworks, even across clinical labs, for example, in the very beginning, or different consortium efforts, that when you have the same rules, there might be a little bit of differences in the way that you apply them, but the standard of curation is much more harmonized when you have these frameworks. And so we have found that these ClinGen frameworks, when they're used and implemented, and we have knowledge that they are used and implemented, do really standardize the curation process.
Wow. Yeah, that provides a very helpful framework. Now, focusing on the African context, what are the key gaps in clinical genomics capacity across Africa today?
I think it is bodies, curators. I mean, we see this in other places, and I think it's particularly true here. There are many people who are very interested and very excited. And I think we need to have as much training as possible to be able to train up experts in the field and eventually maybe train the trainers so that they can go and disseminate all of the information too. And so I think that there is the motivation, the know-how, the intelligence, like it's all right there. It just the training needs to happen so that you can have more trained individuals. I think that in clinic, in genetic counseling, just all of that, because there are definitely some really excited people, and we got such an overwhelming response for this workshop. At first, we had said maybe we'll see 20, maybe we'll see 30. The numbers just kept climbing and climbing. So there's definitely tons of excitement about genetics. I think we just need to have a trained workforce and really try to expand the training of that workforce.
Yeah, yes. Thank you for sharing that perspective. In terms of practical support, how can training programs better support clinicians and researchers to confidently apply variant interpretation in practice?
I think that really, I've said this a couple of times now, and I don't want to repeat myself, but I think those train the trainer workshops are really the most critical thing, is to really get people on the ground in like local regions so that they are a resource for people who have questions, because I'm happy to answer questions. I'm happy to work with others, but I'm just one person. So I think the most impactful way to do it is really train a group of people who are very familiar with the environment, familiar with the clinical setting in Africa, for example, in the different specific countries, and then they can act as resources. And that's also a bit of a jump and a promotion in their career too, because they can say that they are now a validated trainer and working through and training and mentoring individuals. So I think that's really the most impactful way to do it, is to intensively train a group of individuals who can then go on and train the workforce in your local area.
That's a very valuable insight. Thank you, Doc. Looking ahead, what opportunities do you see for expanding collaborations like ClinGen PAPERI?
It's a great question. I think we've talked about future workshops, potentially more in-depth workshops. Maybe we can do train the trainer workshops. And we are always extremely happy to have individuals from the group to volunteer with ClinGen, just so that we can have these, permanent connections, and people who are really interested in particular disease areas can contribute their time and like further learn in that particular disease area.
All right. Thank you very much, Doc. As we approach the conclusion of our discussion, what advice would you give to early career professionals interested in clinical genomics and variant interpretation?
Yeah, it's a great question. I would say network as much as you can. The field is both big and small at the same time, and that many people are online. So I am always telling everyone, if you want to learn, if you want to dive into this field, volunteer for ClinGen. I've had so many individuals who've had little to no genetics experience, and after a couple years with ClinGen, they're getting jobs as variant scientists. They're going into genetic counseling programs. They're starting postdoctoral fellowships in genetics labs. We are very happy to work with individuals and help them learn. I will say also, we are going to have a virtual career series in ClinGen over the summer. We took a break for a couple of years, but this is going to be an online session that we'll have for 4 weeks. We'll be advertising it very soon, where we talk about different careers in genetics, and we'll actually have panels of individuals in those different careers. So for example, MD geneticists, so like clinical geneticists, laboratory geneticists, genetic counselors, and most importantly for people trying to break into the field, stepping stone careers. So like genetic counseling assistants, research assistants, ClinGen curators. So I really do encourage those individuals to take advantage of things like this that are available online, that are entirely free, open source, to just get you engaged, because as soon as you make that connection with someone, it can really help to move your career further.
Thank you very much, Dr. Marina, for these insightful reflections. I'll now hand over back to Dr. Wafaa for closing remarks.
Thank you very much, Dr. Marina, for this insightful and inspiring discussion. At PAPERI, we truly believe that strong partnerships are the foundation for sustainable impact, and today's conversation reflects the shared commitment to advancing clinical genomics education and capacity building. We are deeply grateful for your time, expertise, and collaboration, and we look forward to continuing this important journey together. Again, thank you for being part of PAPERI's second anniversary celebration. Thank you very much.
Of course, thank you for doing what you do. It's extremely inspiring, and I'm excited for the second anniversary.
Thank you. Thank you, Abigarl.
Thank you, Doc. Thank you, Dr. Marina.